Hi, I'm Hillary Talbot, acupuncture physician and clinical herbalist. Today we will be discussing acupressure points for the bladder and kidney. Now, the bladder meridian is actually the longest meridian of the body. It runs from the nail bed of the pinky toe all the way up where the red and the white skin meet on the foot, into here, up the back of the leg, and then it continues all the way up the back. It goes up and down the back a couple times and then over the head into the front of the face. And the kidney meridian actually starts here on the bottom of the foot and wraps in and comes up the front of the body. In Chinese medicine, these two organs are related because they comprise the water element. So treating the source points of both of the organs at the same time is something that you might do or you might experience if you go to an acupuncture physician. So I'm going to show you the source points of these two meridians. The source points are said to have a direct connection to the organ itself, more so on the yin organ, so the kidney organ, but we can certainly treat them both. Bladder 64 is located on the side of the foot, and there's actually one bump here, which is bladder 65, and then 64 is right before this big nodule on the joint of the side of the foot here. So it's right here in the middle of the foot, bladder 64. If you want to get really fancy, you could treat that between 3 to 5 p.m. in the time of the bladder, where the bladder has the most energy, and it might be even more effective. And then kidney 3, the source point of the kidney, is located on both feet, of course. I'm going to show you on this one. On the inside, so right behind the tip of the medial malleolus, which is this pointy bone here on the ankle, and a little dip. So right here. And you just want to use firm pressure. And again, if you want to get really fancy, you could treat this between 5 and 7 p.m. when the kidney is at its utmost source. And this is a great point for adrenal burnout. So if you've been working too hard, extra long hours, this is a fantastic point to just stimulate on yourself at the end of a long workday. There are lots of other points that can have direct connection into the kidney and bladder, especially depending on the pathology that you're experiencing with both of those organs. So I encourage you to seek out your local acupuncture physician. If you don't have one, check out acufinder.com to find one in your area. I'm Hillary Talbot, and that was acupressure for the bladder and kidneys.